It usually happens after a big meal, a burning sensation in your chest, a bitter or acidy taste in your mouth. Now, the good news is, no, you're not having a heart attack. It's just heartburn. And though not serious, frequent heartburn can be. Now, I'd tell you more about it, but I don't quite have my PhD, so here's some qualified experts on the subject.
Heartburn is basically caused by an excess of stomach acid, as well as maybe a weakened esophageal gastric sphincter, and leading to acid reflux from the stomach into the esophagus. So mainly people will have chest burning, especially after eating meals, a metallic or sour taste in the mouth when they wake up in the morning, sense of early fullness, excessive burping. Those are the main symptoms of heartburn.
The risk factors include eating a large amount of spicy foods, eating large meals, especially close to bedtime. Lying flat when sleeping can sometimes cause problems because that predisposes the reflux of acid contents into the esophagus. Smoking also is another modifiable risk factor because smoking also is known to lower the pressure of the sphincter or the valve separating the esophagus and the stomach. And also excessive alcohol consumption also is a modifiable risk factor. Anyone with heartburn, especially if frequent and severe and chronic, should be evaluated because, first of all, it is definitely treatable.
If heartburn is not treated, it can lead to abnormal cell changes in the esophagus just from chronic exposure of these cells to acid, and that can actually cause what's called Barrett's esophagus, which is a precursor to esophageal cancer.
So there are some red flags, warning signs with reflux that should definitely not be ignored and needs to be assessed by a doctor if the patient does have a history of acid reflux.
Thanks, doctors, for that information. I'm Andy Bumatai, and you've been watching Hawaii Pacific Health Online.